not worthy. Big word, 29 alphabet word, but the meaning is not worthy. Okay? I took it from Kerala, Shashi Tharoor. He's a big, English, you can listen to his English, wonderful English, I love his. So one of the words is what he speaks is this. So the meaning when I saw, it's not worth. So if you are not giving the knowledge which is worth, it makes no sense. So you have to take a knowledge which is something worthy, something which is useful, something which you can incorporate it, something which you can help the general population, right? Now, this slide, I just took it a picture from the Google. Can you see dentist, how periodontist sir will be very happy. Cardiovascular, it is related with cardiovascular, pulmonary, endocrine, musculoskeletal, nervous, everything. Right? There is something called as glia cells in the nervous system, and there is something called as a hormone called ghrelin. That's a hunger. So you all are here for a hunger. So hunger should be a knowledge. So it depends on how much your hormone ghrelin is popping up today now in the morning. Let's hope so. How much ghrelin comes out from your mouth, and let's have more of an interactive. Okay. So you want me to talk on this? I can talk, but I'll tell you a very important thing. Rest, I think sir also can put a word on this. How many can connect if a patient sits with you and show that dentists are important or as equal to rest of the body? One of them is cardiology, which is very common, right? Most of them they are bothered about heart. They are not bothered about other things. They keep the other things, particularly dentist is last. They say dental, okay, no problem. I can chew from this side. Some people even front teeth is gone, they'll say, Rafi, no problem. Okay? So, cardiology, how are we related? Anybody? Dentist and cardiology, how are we related? So very important. Let's see. Who answers? Let's have a small question and answer. It's like a discussion. I told you, my lecture will be more of like a discussion. I won't keep presenting you. I make you awake. Your ghrelin hormone should be awake now.
The biofilm and the plaque.
Sir?
The biofilm and the plaque.
Yeah.
Same plaque is being irrigated in the biofilm of the plaque of the heart in the cardiovascular.
Sir, if a general person comes, a patient comes, like a cameraman is. Are you a cameraman?
Yes.
You're not a dentist, right? Sorry. Because we don't know. Sometimes students also they start taking videography and things. So now imagine he comes to you and he is not interested in going for implants. Forget it. I'll come to that also. So I want you to prepare him for implants.
If you don't get your teeth fixed, you will get heart attack.
Sorry.
She too is a periodontist.
Periodontist, sir.
You don't get fixed.
You will
You
get
get heart attack.
You have to
Sorry,
prove me with
pay
the article. You have to
like
prove me with the article.
Prove me that.
To prove me with the article that if you don't get fixed, you get a heart attack.
That's how you reach to the common people.
No, no. I see, we are talking, you're a periodontist, stop being a periodontist. I'm giving you clue also. There is something called as sublingual transformation, right? So we give nitroglycerin sorbitrate. You all agree?
Yes.
Sublingual, fastest route for the CVS. Agree with me?
Yes.
Agree with me?
Yes.
Okay, very nice. Now tell me, all of you saying yes. Now let us see how many of you know what time it takes for a drug to get into the CVS. What time does it take to get into the CVS? See, I'm not an MDS, I'm not a lecturer, I told you, I'm going to give you all practical things. Now when you talk with the patient, this is what you have to talk. Okay, that is where we are related heart and the mouth. How do you relate? That means anything you are eating, it's getting absorbed. Whatever you're taking tablets, it's getting absorbed. Fastest route through one of the veins, major vein. Okay? You all know, I don't want to get into anatomy of it, but tell me the timing.
Immediately. Less than a minute.
Less than a
Minute.
45 to 60 seconds, somebody saying.
Less than a minute.
Less than a minute. Anybody from here? Sir, from back. I'm sorry, see, you're all into perio, ortho and things. You're not able to convince the patient, but I would not use the word convince. Again, we'll come to that answer. How many of you convince the patient? Just now she said, if you don't get it, you're going to die. That's threatening, not even convincing. We normally try to say, okay, I will convince the patient. Agree? You should never convince the patient. You give the knowledge to the patient. Patient might come back or not, that's secondary, but you give the knowledge, he or she will always remember you that that particular doctor gave me the knowledge. And they will come back to you. What we do is, okay, you're not chewing? No, not chewing. Okay, you go for bridge, go for RPD, or go for implant. No. We'll come with a discussion of that. So what is important is knowledge. So don't convince. I'm going to come to that slide also. So when the slide comes, I'll run fast. Okay, since it's coming correlating. So the time taken is check with any of your top cardiologists. So how do I know this? You have to meet cardiologists. You have to meet gynecologists. You have to meet endocrinologists. I was sitting with gynecological conference for 3 days. Twice I went from Bangalore to Delhi. I spent nearly 3 lakhs. The conference is very expensive. And I asked everybody, I'll come to the next, how is dental and gynecology related? The how is dental and heart related? As I told you, it takes in few seconds. Earlier it was 20 seconds, not 1 minute or 40. Now it has proven, not said by me, now it is proven, I can give the name of the doctor also, it's 11 seconds. It takes 11 seconds for any periodontal infection to get into the heart. It can lead to IST, it can lead to aortism, okay, blockage, or acute myocardium. These are the things. So you can imagine now, you are not threatening them. You are telling him the fact. Go and cross-check with your cardiologist. It takes 11 seconds for any medicine which you are keeping that is sublingual. So similarly, your infection also can get into it. So what is your natural duty is? Save. That's what I said. Natural is always natural. So you have to come to periodontist, get the scaling done. Simple. So maintaining oral hygiene is very, very important. So periodontitis can lead to any of these things which cardiology I have told you. Similarly, if patient comes to you, okay, very interesting is gynecology now. You all have heard and we all go. And the day when I started laser, I have never sent any of my patients for any kind of letter which we normally write in colleges to get consent letter from cardiology, consent letter from gynecology, consent letter from so and so. Yes, more than 80% of the cases you don't need consent if you have a technology. So when I met a gynecology, she was, though I referred patients to her, she was giving a negative feedback because one of my patients, my auditor's daughter, she became pregnant. So I sent her, okay, go to this so and so gynecologist because she was also new in the area. By then I had not met. Then she threatened that my patient only, look at this, being a dentist we are referring the patient and she is threatening, don't go to the dentist until you finish your delivery. Have you heard all this? Yes. How many of you agree with this, sir? All experienced people, maybe newcomers they have not come across, but definitely yes. All of you? Now, what is the answer? We all read in textbook something else and I follow something else. And I caught hold of one of the oral surgeon in Anand Sagar, my own college. He was giving a lecture. Then I asked him, what do you practice? You practice whatever you're talking or something else? He said, no, sir. I don't practice whatever I'm talking here. I practice something else outside. It's unfortunate we still have the textbook same way. Okay? But what do you do? If a pregnant lady comes to you and says, okay, I have a dental problem. What do? You refer it to gynecology? What do you do then? You treat? Say imagine you have to put implant because you are here for the implant program now. And say she is in the first trimester. What do? How many of you do implant for first trimester lady? Anybody? Those are all of you have done implant. Who will do? Sir is saying no. Sir is also saying no. Who else? Everybody says no. You send it to me, I will do it. Very simple. Now I'll tell you how it is. That is why you have come here. That's why I said I'm not going to show you before and after. I'm going to do something practically which you were thinking something and today you turn the table down. Okay, I'll show you some of the techniques and technologies where I'm not saying against gynecologists saying. If they are good to us, we should also be good to them. It's as simple as that. Now you tell me, how does gynecology know about implant? Hardly she knows. See, we all know implants. We are been doing implants. Somebody would have done thousands. I have also done in hundreds plus 600 almost implants. But I'm not a real big practitioner for implants. But I do place. I believe in natural saving. That is intentional, grade 3, anything. I try to fix the same natural too. Okay? Even if it is infected. I'll come to that. Now, why is that? Are you all awake?
Yes.
Is it boring? I'll change the way of topic also then if it is boring. Okay, so I want people to come forward. Doctors, can you just, are you able to hear me? Interact? Okay. So you didn't give me answer now. You will treat the patient with implant or no?
Usually we ask them to come after the pregnancy is over.
Why, madam? See, that is what you have to think. Why you should want? She's not a
Sir,
human being.
if it is elective, usually the gynecologist won't prefer that. Just
Sir.
because of the reason, the kid is more important than the teeth.
So who's telling this?
The gynecologist, and even we feel the same thing, sir. Just because myself as a personal experience, I didn't have a kid even after 7 years of marriage.
Okay.
So when it comes to that point of thing, the kid is more important, or the child is more important, the embryo is more important than the teeth.
Fully agree with you. No doubt. Now what is stopping you here is the fear factor. We all have read in pedo and so many other subjects, fear psychosis or the fear factor. What is that fear factor? Is this something will happen, but you don't know what is that going to happen. That is a problem. I'm not saying that whether infant will die. No, infant will not die. It's a factor which leads to stress to the